Hi everyone. Um, Today I have come up with a very interesting topic. A topic of when we are parent to a toddler, and this toddler has been just diagnosed with autism or any related, disorder, and then we get into a dilemma, right? At least I was in dilemma. My first to go place was a preschool, right? So, I mean, let's today, help you to decide between uh, intensive care and a preschool, right? Whether I want to put my child into, intensive therapy, or should I put my child or my son or daughter into preschool? For me, the first place to go was preschool. He was not yet diagnosed at that point in time, but there were a lot of things which he was not doing. So there were a lot of things we were struggling to make him understand, and that is the time he was 17, 18 months. I'm not talking about when he's become 3. He was diagnosed pretty early on. So we were deciding that, okay, maybe he's not learning from us. He needs to be with other children, because we are seeing that he was not responding to his name. He was not giving us joint attention. So that was something where we are pointing somewhere, he's looking somewhere, he's not interested in any of the children. And hence, that made me think that, okay, let me go and get him enrolled in any preschool, right? And then incidentally, we went to this developmental pediatrician, and she said yes, he is on the spectrum. Then naturally we generally want to have more opinions, and we got more opinion, and we went to a very senior neurologist who was also a developmental pediatrician, and he said that he my son was on the spectrum. So I started slowly learning about what exactly this is going to look like. And for me, preschool did not work out. Okay. And what I was reading, what I was learning uh, about autism, this was not something for me to go for, so let's first break it down. For me, preschool did not work, but not it is not correct for everybody, right? It's not correct for all the children on the spectrum. So, but how to decide, right? So, my child had not developed language till then. He was still non-verbal. Speech came and it went off within a month, and by 19 months we were completely mute. The speech came in 17 months, and he just spoke few words, that too for a month, and after that, that was also lost. So, putting him in a preschool with no help, with so many children, was not an option for me. That was the case of Rana. But if your child is speaking, if your child is, does not have too many sensory issues, and if a child is able to tolerate so many people in a room, then yes, why we want to put our children in a mainstream school is for the social interaction, for the peer modeling, right? uh, and exposure to a group activity, routines, and structure. Then also we are giving them an opportunity to generalize, right? It's like the child is generalizing, the teacher is asking, the teacher changes, or some children are coming and interacting with our child. That's the thing, that is these are the main reasons why we want to choose preschool for our child. And what are the challenges that our children can face in preschool is that the preschool might not be equipped for special needs. The teacher to child ratio is also very high, right? It is not like 4 or 5 children in a room. There can be at least 10 children. Uh, so that one-to-one attention is also not there. The teacher who's taking care of 10 children might not be aware of how to interact or be patient with our children on the spectrum, right? Generally, I've had a mixture of both intensive therapy along with the preschool kind of a combination, right? uh, then so these were the pros and cons when it comes to the preschool. And what are the pros and cons of intensive therapy? Now, intensive therapy, especially if the child on the autism spectrum and is not understanding, the receptive language is not developed yet, the expressive language, anyways, the speech is not developed. Okay, and it's not only about communication, it's also about the sensory requirements. It's also about the motor skills, isn't it? Like if you go to preschools, what exactly they do? Basically, they sing songs together, they do some activities, they do some actions, they learn the body parts. So that kind requires, it requires a lot of focus on the teacher. It requires imitation skills, right? So all these things are required when uh, our child has to go into the preschool with all other children not on the spectrum, right? Basically, we want to give them a social interaction. Now, if these prerequisites which are needed for a child to blend in the with other children is not there, then I suppose it's better to look for intensive therapy. So I had chosen occupational therapy for my son, which was happening during the day, or maybe you can choose it to have it in the evening as well if you want to send your child for a preschool. But Ranak was having a lot of issues when it comes to his motor skills, when it comes to his sensory sensitivities. So I chose intensive therapy. At that point in time, I understood that he's not even taking the commands. He's not understanding language absolutely. So there was like he wouldn't respond to his names. Okay, that's very typical of a child on the spectrum. But he's not understanding any other language as well. Like I point, I'll say look there, or Ranak, let's look at the tree, and he's looking the other way around. Okay, and I was also trying to understand what exactly it was. And when I was reading about the therapies that are available, so I was lucky that in our city we had ABA kind of a setup where we had BCBA certified director of the center where Ranak was going. And the more I started reading about ABA as a form of therapy for our children, I started believing in it, and I started feeling that yes, more intensive is required. It was said that 40 hours of ABA therapy is like 8 hours a day. But at that point in time, when Ranak was not even two, I got for 2 hours, and I started off with intensive therapy for him with 2 hours. He's not even two, right? So 2 hours was also a big time for him, and he started picking up things, right? So for us, it worked well because he was on the severe side of autism, where he required, understanding of language. Speech production was not there. Understanding, that is the receptive language, was not there. His imitation skills were not there, and and to be able to follow through the commands, if the language reception is not there, I mean, he was not prepared for a preschool. And I have seen I've seen many children, many parents, they say, no, no, I want social interaction. I want my child to blend in the, you know, in the group and start learning. So I have gone myself along with Ranak to preschools and stayed there for a while to see how he will function and see if there is any other child on the spectrum in their group, right? So I have seen that, parents are too keen. Sometimes we are over expecting from our children, and we try to put them in an environment where we want to put them. You're getting my point? We want to put them in preschool. They might not be ready, because I've seen children stimming and the teacher ignoring the child, and the teacher is communicating to the other children who are able to respond to her, and it's like crowd mein our child is lost, right? Not only that our child is lost, our child's time, very important time is lost. ठीक है? और क्यों हमने लूज करने दिया वो टाइम? Because we want them to be there. We want them to be there, and hence what we do is we force them to be in a place where they are not blending yet. They are not blending yet. They will blend. It's not that. But let's prepare them before sending them to preschool is not a go-to thing. So it's very nice to sit down and observe your child. ठीक है? Observe कीजिए कि उसके अंदर क्या क्या अभी challenges हैं. Accordingly, then you decide that yes, preschool will work well for my child. Preschool also, you have to go and check out with the teachers, see how patient they are, how much they know about the condition your child is in, right? Don't take any hasty decision, right? You can always go and tell them, I just want to keep my child as special. My child is on the spectrum. I want to see how he or she is blending, right, in the thing. And generally, I've seen many times it's the preschool who comes back to the parents and says that शायद आपके बच्चे में कुछ problem है, right? So, like, first thing parents will do is they want to put the child in the preschool, and many times the preschool people come back to the parents, say that why don't you get your child checked, right? We are seeing some delays, right? So it's very, very important to see how your child is, right? Many times the diagnosis goes the diagnosis has not happened, and we have taken decision to put our child in the preschool, and that is what I was about to do with my son, because I didn't know anything about autism. But one of the doctor mentioned that I don't see that kind of communication happening with Rana, so why don't you get him checked? And once we got him checked, we got the diagnosis, and that this was pretty early on. This was 19 months. He was just 19 months. And that is the time we were thinking, okay, let's put him in the preschool. Maybe he spends some time with, other children, and he will start learning how to eat on his own, how to, move around, how to talk, all these things. We thought it will come. And 18, 19 months, the child's life is just beginning, right? It's just, I feel he's just coming to the consciousness level, right? We all don't remember what happened into our life for the first 1 or 2 years, right? So he's just started living, and how can you just say that nothing is going? We are still waiting for certain milestones to be met, and hence we were thinking of preschool. But once he got diagnosed, and not all children on the spectrum get diagnosed this pretty early, right? They might be diagnosed a little later, right? So it becomes a dilemma for all the parents to decide between intensive therapy or or a preschool, because they want socialization, they want peer modeling, and for me, intensive therapy really started working well, and we made him ready. I got a combo of these two things. because we got only 2 hour slot in the morning, he could have gone for his preschool thing. Preschool is only for 2 hours. But I chose not to go for preschool also because I wanted to include certain therapies, especially the sensory integration and occupational therapy for Ranak. And he was still too young, right? He was still too young to have so many things on his plate. Slowly, once he started getting he was able to tolerate other children, he was able to behave in the class, sit in a place, get a little bit of instruction from the teacher. And by the time he was 4 and a half, 5, of course, I could at least do a summer camp in a preschool. We did summer camps in preschool, right? To give him an exposure to, the socialization. That is what is in our mind. We want the child to blend in the mainstream, isn't it? So that really worked. And intensive therapy, sometimes parents feel that, whatever he will learn from the ABA sessions, or, all those things are anyways getting taught in the preschool. So why not try that? What happens is the ratio is pretty high. You don't get one-on-one a one-on-one therapy, and our children need that one-on-one therapy, especially in the beginning time, especially in the formation time. And I feel that, early intervention and early intensive intervention. Intensive, what I mean intensive is more number of hours in the therapy center, right? Then there's a lot of repetition that starts coming in, because our children need repetition in the beginning, because language नहीं आ रहा ना. Language, जब तक उनको पूरा language समझ आने लगेगा, तभी तो they'll be able to take our commands or take the command of the preschool teacher, right? वो भी repeat करते हैं, ऐसा नहीं है, वो भी repeat करते हैं, but normal children, they don't require as much repetition as our children would require. And hence, the conclusion is, depending on your child's challenges, you decide whether you want to, make a combo of both the things. If the child does not require, too many hours with the therapy center, maybe preschool in the morning, and in the afternoon we can have an intensive therapy plus an evening therapy of maybe a special, not a special education, but yes, intensive therapy of occupational therapy, sensory integration, some time with the parent, and to summarize this is, yes, all these things, all the preschool as well as the intensive therapy, it's going to bring a lot of changes in our children. But at the same time, we need to also equip and empower ourselves, because the main thing happens at home, because the child stays with us, right? So थोड़ा सा अपने आप को भी कुछ parenting strategies पे equip करना also makes a lot of change in the child's life, right? And अगर आपको decide करना है, तो maybe we can have a 1 year of a very intensive therapy with the child. The child is now ready. Maybe the speech has come, receptive language has improved, imitation skills have come. That is the time when we can reduce the intensive therapy and increase the preschool time. So these are the tricks that we as parents need to write down. And the best thing, I think, the best thing to do, the best way to do is write down what are the challenges, how those challenges will be met, right? And if my challenge is basically language is there, imitation is there, but he's not making friends, he's not mingling with the society, then that is a time to put your child into the preschool and give them an opportunity to be with his friends and his age group people, age group children. So that's how you decide. So you can always this can be balanced in some way, right? If the child is too young, we still have time till 3 years, 3.5 years for preschool to come. And if the child is diagnosed pretty early on, then intensive therapy and then you can have a mix and a blend of both the things, preschool as well as intensive therapy. It works well. It worked well for me, but first I started off with intensive therapy. Once he's ready, I started taking him to preschool as well. There also, I was keeping an eye. I was being there because I was not sure whether teachers are equipped with the knowledge of autism. Teachers are equipped with handling our children and their behavior, right? So behavior modification is also very much, it's a main thing. Behavior modification is a main thing where while we are planning on a preschool, if the behaviors are so extreme that we are constantly called upon by preschool people that your child is not feeling comfortable, or because what was my observation was that children who do not get a intensive therapy or are not ready for the preschool, and we parents who try to put them directly into preschool, I've seen they are just wasting their time because the teacher is completely consumed with other children who are responding to her, and this child is left alone, even though you are feeling that the child is in a group, but the child is still alone in the group. So it's always better to give a one-on-one attention, make him or her ready to be in a group, to take commands in a group, and then you can always take your child to so early intervention, intensive intervention is the recommended thing to go, because if there is language delay, then language needs to come, receptive language needs to be there, some communication tool should be there. If the verbal communication is not still to develop, then some communication tool has to come, and all these things require intensive therapy. It can be a special education or ABA, whatever is available, right? So I would feel that that would be, because the morning time, preschool is always in the morning time. Morning time is the most energetic time. Our brain is ready. We are full of energy. We and our children are also full of energy at that time. So that time, what you have to see where you want to utilize that energy levels, whether for intensive therapy or for socialization. So you just see. So what are the skills that my child is lacking? You write down those challenges, and those skills are lacking only for the time being. It's not that my child won't be ready to go, right? So I don't know whether I've ever mentioned that Ranak's doctor actually mentioned that he would never make to mainstream school. That is what she actually said, because Ranak was all screaming and flapping his hands. And he was at that point in time 19 months when we ended up in the doctor's clinic. And she said that I have rarely seen any autistic child ending up in the mainstream school. And I'm sitting there and I'm just thinking, well, she's nobody to decide my child's future. Right? His life cannot end at 19 months. Yeah. And I'll make sure he goes to mainstream school. And my dream came true. Right? So it's basically what you believe will happen. So don't let anybody tell you that he or she will not be able to make it to mainstream school or a preschool or whatever. So don't let anybody tell you. If we work with our children with proper strategies which are scientifically proven, right? You can empower yourself by reading certain books. You can empower yourselves by talking to the therapist that we go to. That's how I empowered myself. See how they work with your child. Just replicate it. Right? And then there is a lot of hope. Never give up on your child. Our children are not lacking in any potential. Little wiring went haywire. And with proper strategies, we can rewire their brain again. Okay? So that's what I wanted to bring to this live session, that how to decide. Sometimes let's not do what we want to do. Let's see their challenges. What are the skills we want the child to have before the child ends up in preschool? There is always an opportunity to have a blend of both the things, right? The preschool as well as the intensive therapy. It's just how we will balance it, right? So that brings us to an end of today's discussion. Before we end today's discussion, let me share with you a little bit of my journey with Rana. While we were deciding on all the therapies and all the combos, and I was sitting and researching, understanding what can bring healing to my son, who was not sleeping through the nights, who was not able to chew his food. His muscle strength was very poor. Though he was restless but not hyperactive because his body was not annoying, he was delayed when it comes to his milestones as well. And he was not able to digest most of the food. So that led me into the field of healing him, to bring in more physical health so that he's well prepared for the therapies, right? So now he is soon going to be 17 years of age, 16, and we have overcome most of our challenges by healing from within, and that was with the diet, detox, nutrition, and I help parents who also believe in healing their child from within, right? So I have a session tomorrow at 5 p.m., which is my master class. We will discuss what exactly I did with Ranak to bring him where he is, from a very severe autism to mildly autistic growing child who's thriving every day, giving me showing me improvements even at the age of 17, when a lot of not he's not exactly 17, but yes, he's almost touching 17. And when a lot of people say that you don't see much improvement at the later stage, I feel the improvement can happen at any time. It's only that we just change the way, change our old methods to new methods which have proven to show a lot and lot of improvement in in the symptoms that we call as autism, right? Or any mental health issue, as so that we will dwell in detail tomorrow at 5 p.m. And we have a online session again, on a Zoom session, and I invite all of you to come join me tomorrow, and we'll take it further tomorrow at 5. You can get the link on my bio, and also on the messages here. My website is rachnaautismcare.com, and there is a masterclass there. You can click on the Zoom link there and come join me tomorrow at 5. With that, we end the session today and hope to find you soon again on the live session. And we'll take yet another topic which really, puts puts a confusion in our mind, and sometimes we are not able to make the correct decision at the correct time for our children, right? Then see you next time. Bye bye. Take care.